at the messy desk again to tackle another one of the tricky exercise questions. When and how should I breathe? And that depends on so many different factors. So if you are doing high intensity interval exercise like burpees, weightlifting with some sort of cardio component, maybe you're going on a 100-meter run every so often. We do this in CrossFit a lot. Any of your internet HIIT classes will prescribe these. Boot camps are very common. The biggest thing that I try and dissuade my patients to do and my athletes is panic breathe or neck breathe, and that's with using all these accessory neck muscles, and you'll see that a lot. That's why you see people go hands on knees when they get really, really tired, because what they're doing is they're bracing themselves to reduce the amount of strain and effort used by these accessory breathing muscles, because they're overusing them, and you shouldn't be using them hardly at all. You should be belly breathing and diaphragmatically breathing in through your belly button and breathing down rather than breathing up into the neck. You don't actually get as much oxygen that way, pulling your shoulders up and straining the neck. And those muscles are all very small, and so they strain very quickly. Another interesting thing to note in terms of squatting and deadlifting heavy, right? High-level weightlifters and powerlifters they'll brace and they'll push their guts out into that weight belt, which creates a rigid core that helps to support the core. It doesn't keep you from bending. That weight belt isn't there to keep you from bending and to hold your back stick straight, right? It's to actually push out against and create some bracing with your abdominal muscles and the core strength that you already have. Important things to understand about that is there's a couple of notable patient populations that we do not want them to hold their breath. One is anyone with a pelvic floor disorder. Anybody who has had pelvic floor muscular weakness, incontinence is most common. My postpartum moms are the most common in this category. We don't want them holding their breath because an increase in intra-abdominal pressure can disrupt some of those delicate pelvic floor structures and create problems there. The other patient population that I do not want holding the breath during a squat, and in fact I would lighten the loads on this substantially. I'd have them working with a PT and a coach of some kind. Would be anybody with a history of lower back disc herniation. We have a triad of symptoms that we see as being an indication. This is in the literature, in the research, of being an indication of disc herniation. If you cough, sneeze, or strain, you get leg radiation. That's a huge indication that you have some sort of lumbar disc issue. And again, it's that breath hold and that increase in intra-abdominal pressure that creates the pressure in the disc that goes against the nerve and creates problems there. So we want those patients to be breathing all the way through and creating that tension in their midline or tension in their core externally, still being able to breathe, right? So we don't want to increase that intra-abdominal pressure to create those issues. So yeah, it's kind of a loaded question. There's a lot of things to kind of look at there, but that's what's on the top of my head. So hopefully that helps.